Hi everyone and welcome to this new week. Welcome to the Monday 8 p.m. And in this week we are going to cover up the MCQs, the discussion, the important topics of embryology and histology. So for around 3 days we'll be covering up the embryology, and for the last 2 days we'll be covering around 20 odd images of the histology. Welcome all, I'm Dr. Ankit and welcome to our YouTube channel Human Anatomy by Dr. Ankit, and do also start to listen or to hear our clinical vignettes. There's a new sort of series I've started on the YouTube Shorts and also on the Instagram handles. The clinical vignettes, they will be there. So a quick, revision of the important clinical cases that will be shared over there, having an anatomical basis, of course. So let's start this. So where are we this week? This week we are over here from 26th of Feb to 1st of March. Embryology and histology is what we are going to do daily around 8 p.m. from Monday to Friday, right? Fine, let's start with the first MCQ. So there will be two MCQs. So the MCQ discussion will be on a span of around 5 minutes or maybe less than that. Let's start. The first question goes that the notochord forms an initial axial skeletal element of the body and induces the formation of the neural plate. Yeah, notochord induces the formation of neural plate. Which of the following structures is the sole postnatal remnant of the notochord? Yeah, that you should be knowing if you have done any PYQs or if you are have gone through embryology, that the sole remnant of the notochord is basically our nucleus pulposus. Nucleus pulposus, that we can see over here as option number B over here, right? But do remember, first of all, a couple of things, that what is nucleus pulposus? If you look at the intervertebral disc, okay, then in the intervertebral disc, what we have an outside annulus fibrosus, and in the middle we have this jelly type material, that is the nucleus pulposus, which is mainly responsible for those prolapse of intervertebral disc what we normally study. Now, apart from the nucleus pulposus, are there any other remnants is the question. Yes, there are a few others, like what? Like if nucleus pulposus is not in the options, we can go with the membrana tectoria, remember that, right? Membrana tectoria, and we can go with the structures related to the membrana tectoria, particularly the structures lying in the nasopharynx, in the posterior nasopharynx and all that. So that could be another answer, but normally they give option as the nucleus pulposus. Fair enough. Let's see the next one. Disruption of the further development of the structures indicated by the X could directly affect the formation of which of the following structures. So if you look at the image, here is the X written. Now X is pointing out where? X is pointing out at this area. So we have to identify that what exactly is this, right? You can look at developing embryo, you can look at the ventral aspect and the dorsal aspect of the developing embryo, right? Just a second. Okay, so if you look at the developing embryo and the ventral dorsal aspect, what you see over here are the particular blocks of some tissues. They are very close to the axis. They are known as a paraxial mesoderm. What are they known as? Paraxial mesoderm. In other words, they are also known as what? They are also known as somites. So these are the somites. We have around 36-37 pair of somites, which gives rise to different structures like skeleton, muscle, and the dermis. Sclerotome, myotome, and the dermatome, right? So they are asking that this X would give rise to which structures. Let us see the 4 options. Okay, let's start the option number A, bones in the hand. Now, bones in the hand looks like a skeleton, but remember that from the somites, let me first of all cover this small topic, somites over here. Somites gives rise to basic 3 main structures, which are what? Which are the sclerotomes. You can understand the skeleton part, but which skeleton? Mainly the axial skeleton. Remember that, not the appendicular skeleton as like bones in the hand. And in that axial skeleton, let me write in the brackets minus sternum. Sternum is not derived from this sclerotome. The second part that comes from here is the myotomes. So what are myotomes? Obviously giving rise to the muscles. Now these muscles will not only be confined to the axial skeleton area, but they will go to the appendicular skeleton as well. So it is a more, there's more distribution or wider distribution. The third will be the dermatome. Now dermis, that is what it is giving rise to, the dermis. But if I ask you with the common sense, apply common sense, it will form dermis of the ventral part of the body or the dorsal part of the body. What do you think? Where are the somites? They are present posteriorly. Therefore, they will form dermis of the dorsal part of the body, dorsal body wall. Okay, so this is how the somites, they give rise to various structures. Now, if we come back to the options over here, Now we have some knowledge, primary knowledge, we can apply that in the options. So bones in the hand, it's not coming from the somites. Then from where is it coming from? Do remember, it comes from the lateral plate mesoderm. Skeletal muscles in the arm, option number B would be our best answer as we discussed about the myotome. So this will be the answer. Body hair, now hair or the skin appendages, they come from the surface ectoderm. Hair, nails, all that. Lining of the intestines. Intestines are more structures which are lying on the inside of the body. And the lining of the intestines are basically those epithelium. And do always remember that our body embryologically is formed from 3 concentric tubes. This being on the most inner side, it is formed from the endoderm. It is formed from the endoderm. Okay, so therefore answer will be our option number B. Right, so that was the 2 MCQs. I hope you're enjoying it. We'll meet again tomorrow with another session of the embryology.